All right, one last question. You just spoke of the significance detector, and I know as a cranial therapist that's when the pulse just stops all of a sudden. But there's also another kind of stoppage of pulse called the still point.
Correct.
Can you tell us more about the still point?
The still point is, I would have to say, it is the major therapeutic technique for the cranial practitioner. What our job is to allow the body to come to stillness, because if the body is tense, is stressed, first of all on the physical level, the muscles are tight, blood and fluid can flow to the area, it doesn't allow self-healing to take place. Interestingly enough, just want to say a little word in Hebrew, we use the word for healing is the same root word as to make soft. Rofeh is the doctor, and mirapeh is to heal, and raf and rifayon is relaxation. So it's the same root word. It's very, very interesting how we see in Hebrew that raf, rifayon, harpaya, which is all manifestation allowing the body to relax, allows healing to take place.
Interesting.
And in English, as I mentioned before, disease is dis-ease. When the body is not at ease, then the process sometimes it's immediate, sometimes takes a little bit longer and it's chronic, that there's a process of disease when the body is not at ease. The still point is the body's, we go into still points all the time. The healthier you are, the more still points you will go into. It's the body's way of resetting and rebalancing and going into a state of quietness and state of rebalancing and a state of self-healing. When people sleep, and that's one of the major reasons why people need to sleep, is because it allows the body to rest and to bring it to still point, a stoppage of the cranial rhythm. When there's a stoppage of the cranial rhythm, there's a sense of total quiet of first the brain, the spinal cord, and the nerves are relaxed, and the innervation to the muscles and to the organs are not fired like they are during the day, and it comes to rest and able to heal itself. What we do in terms of when we cause a still point, when we induce a still point, is we from the outside allow the body to come to that point of stillness. People who do a lot of meditation tend to go into the still point regularly, and when you're in deep meditation, and they've done some brainwave studies that the body is actually many times in a very, very deep still point. So our goal is to basically bring physically a way to bring the body into total relaxation. When the body is relaxed, then the body can have the self-healing mechanism to come into play, and people tend to be happier, healthier, more balanced, more relaxed in their life, more focused, and basically manifesting what they're here in the world to do, which gives them a tremendous focus of who they are, what they are. Of course, it's also a form of very, very, very deep meditation, deep relaxation. They can go back into themselves, into their body, mind, and spirit, and the practitioner just allows that process, that healing process to happen. And that's the beauty of the still point, because it's a very, very simple technique, it's a very, very gentle technique, but it's a very profound and very, very deep technique for not only just for the client, but also for the practitioner. I highly advise it, and I'm sure we've done it many times, and we know the healing effects of the still point.
I can attest to that. So, Shmuel, thank you so much.
Oh, my pleasure.
Really appreciate your time this morning. And for more information about what Shmuel does, he practices here in Jerusalem. His private practice and courses all around Israel. and you can visit his website at chiisrael.wordpress.com. That's right?
That's our blog. We have a new site.
Okay. Go to the new site also at
is chi.org.il.
chi.org.il.
Okay. And also the Facebook. We have a group on a chief group on Facebook.
And check the Facebook page. I'll paste it underneath the interview when I post it.
Okay. There you go. Thanks, Matt.
Thanks, Joel.
My pleasure.